past is dead. Let it bury its dead, hopes and its aspirations. Before you lie the future, a future full of golden promise. Jefferson Davis. The past would have been dead for those soldiers if it hadn't been for doctors. In the Civil War, the amount of doctors was very limited, and men would be lucky to be accompanied by them. They would be even luckier to live during a treatment. The treatment offered by the on-field doctors was very mediocre, as the doctors' training was very limited, and they were unqualified. The concept of antiseptic and clean practices was a foreign concept. Most doctors believed that a wound was healing when pus started coming out, but in fact, it meant that it was infected. Also, doctors seldom washed or disinfected their tools. But when they did, they normally just rinsed them with water.
In those days, the same instruments may have been used on patient after patient, and hand washing was something that only occurred really for to help the surgeon get be more dexterous, not necessarily clean. Obviously, amputation is now done whenever possible in a sterile area with instruments that have been completely autoclaved and are free from any kind of germs.
However, there were some doctors who knew that the right treatment was. Clara Barton, and founder of Red Cross, was one of them. She administered much-needed supplies and care to wounded and sick soldiers. Antibiotics hadn't been discovered. Also, they didn't have anesthesia like Novocaine that we do today. They just used alcohol to intoxicate the patient or chloroform to knock the patient out. If they didn't have a supply of alcohol or chloroform, the patient would bite on a bullet or similar object. This is where the term bite the bullet came from. Amputations were done with much less care than today. When they were short on time, the doctors used a saw to cut the limb quickly so that the patient didn't die of shock and pain. The doctors relied on a process in which new capillaries and thick tissues formed to create a scab for the healing process. When the doctor had more time, they used a knife to cut off flaps of skin layer by layer in a fish mouth shape. When they got to the bone, they used a bone saw to cut through. They sewed the flaps together to form a stump at the end.
Doctors use a variety of medications for different illnesses. For example, dysentery was treated with mercury. Some other medications included chloroform and either used as anesthetics for surgery. Operation pain was often treated for morphine. Medications were used only for major injury. They used a completely different procedure for minor injuries. Usually, doctors would leave any minor injuries for them to heal. If the injury was slightly harsh, they would either stitch it or amputate. The doctors were so cautious at some times because they did not want the body to shut down from a major infection. Other times, doctors would have to be careless because they only had a small amount of supplies after a bloody battle. During an amputation, a doctor would use a variety of tools to get the job done.
So at that time, amputation would have been done with scalpels to cut the soft tissue, and then a hand saw, which would have required a clamping down or a holding down of the limb while the bone was literally sawed through like a stick. Nowadays they use oscillating saws, electrical oscillating saws, which make the cutting of the bone very quick and easy. So it's done in seconds and probably is the least delicate part of the operation. In the old days, this was done with a handsaw, and a skilled surgeon could use a circular handsaw and perhaps get through a large bone like the tibia or the femur in 20-30 seconds. However, that is hoping that the patient didn't move or wake up during that time. One of the difficult things for patients recovering from amputation is something called phantom pain. The nerves themselves aren't necessarily able to, are not necessarily aware, or your brain at its most basic level is not necessarily aware that there's no longer a limb down there. So patients will sometimes have sensations that are called phantom pain. Well, they think that the leg that's gone, or the foot that's gone, or the hand that's no longer there is causing them real pain, and they'll feel it as if the fingers or the toes were still in place.
Straight forceps or bullet intractors that were used for removing lead, the large amputation saw used for cutting bone, curved scissors for cutting tissue, and bandaged materials. Probes were used to locate the foreign object in a wound.
In a surgery, tenaculums were used to hold down body parts such as arteries.
Tourniquets were used to compress the arteries above the cut to cut off the circulation. A bone brush was used to brush away bone sawdust from the cutting site. Various knives were also used for slicing through soft flesh.
Nowadays, there are many medications and vaccines that we take for granted, but in the Civil War, few even existed. The drugstore and small research lab called John Wythe and Brother was founded in 1860. It quickly grew into a wholesale business, and they sold things like beef extract and other pharmaceuticals to the Army. The medical company located in Philadelphia called Powers and Waitman introduced quinine sulfate, which is cinona bark extract. They introduced it as a treatment for malaria in the United States in the 1820s. One of the most common medicines used was chloroform for knocking out a patient, but sometimes whiskey was used to intoxicate the patient. Post-surgery medications were used to ease the pain. The most common one was morphine, despite its addictive properties.
The surgery for amputation is a careful, many hours long procedure, where before they may have, if you were lucky, given you some whiskey or some other intoxicating liquor or chloroform. The surgeons today will very carefully find each of the nerves and blood vessels, tie off the blood vessels, pull the nerve out so that it stretches, cut it so that it pulls back. And this keeps the nerve endings from being close to where the scarring in the leg would be, or the arm, after the amputation.
Gunshot wounds weren't the only medical issue. Disease accounted for most of those deaths. A common disease was typhoid. Typhoid was caused by contaminated water or food. Pneumonia was another big player. It was responsible for over 37,000 deaths in the Civil War, and 1 in 6 people who got it died. Stonewall Jackson caught it after being shot in the Battle of Chancellorsville. Measles, tuberculosis, malaria, and smallpox were also diseases that took a major role in deaths. Malaria was spread by mosquitoes that were infected with this disease. Tuberculosis stayed with someone the rest of their life because there was no treatment at the time. When one had it, they coughed up blood. Also, dysentery was caught by drinking contaminated water.
In our nation's war, roughly 1,264,000 soldiers have died. In the Revolutionary War, only 25,000 people died. In World War II, 405,399 people died. Amputation was one of the greatest discoveries in the Civil War, but this is not thought of being the greatest discovery now. The discoveries that the Civil War made worked at the time, but they were some of the worst decisions ever. This included mercury, never disinfecting tools, using contaminated water, and not teaching the doctors how to work efficiently. Although the medical portion of the war was bad, it helped us learn a lot about different diseases. amputations in which we still use today, and certain tools to use in certain procedures. In all, the Civil War helped our progress in our advancements towards our modern-day procedures. Although the Civil War's medical practices weren't nearly as advanced as today's, the soldiers' endurance, courage, and belief for what they were fighting for got them through.